A panel of national experts has issued a new draft recommendation on taking aspirin to fight against heart disease and cancer. But the practice is not without risks and controversy. Weijia Jiang reports now from Washington.
For the first time, the U.S. Preventive Services Task Force is recommending a daily low-dose aspirin to help prevent both cardiovascular disease and cancer.
For people who are at higher risk of heart attack and stroke, taking a low-dose aspirin daily has important health benefits.
The task force says daily low-dose aspirin taken over a 10-year period may help high-risk patients between 50 and 69 avoid their first heart attack, stroke, and colorectal cancer, as long as they're not at high risk for bleeding problems. Aspirin is a blood thinner, and Dr. Stephen Nissen, chairman of cardiovascular medicine at the Cleveland Clinic, is concerned it can lead to bleeding in the GI tract and even in the brain.
We worry that aspirin will be taken by a lot of the worried well, where the harms are going to exceed the benefits.
Doctors agree you should consult your physician before deciding what's best for you. Weijia Jiang, CBS News, Washington.
And Dr. Kevin Campbell is a cardiologist and an assistant professor of medicine at the University of North Carolina. He joins us now to talk about this and some other things that we're going to get to in just a moment. Thanks for coming.
Thanks so much for having me.
I appreciate it. So this is really big news today because there's a lot of conflict amongst professionals in regards to taking aspirin daily. It's not the same for everyone.
Absolutely not. You know, we know that if you have heart disease, taking an aspirin every day is preventative for having a second heart attack. However, if you don't yet have heart disease, we have to assess what your risk for having heart disease is and weigh it against the risk of taking aspirin and the side effects related to aspirin.
And what could be some of those side effects?
The most common things we see with aspirin is bleeding from the GI tract and also bleeding in the brain, having a stroke with hemorrhage there. And that can be devastating if it occurs.
So hypothetically, what kind of patient would be recommended not to do this?
If you've had a history of major GI bleeding in the past, if you've had a history of any type of stroke where you have bled into the brain, you're not a candidate for taking preventative aspirin. However, if you have an annual risk of about 10% over your lifetime of developing heart disease, you'd be a great candidate to take this in the right age bracket.
Now, also, we did hear about the recommendation of taking aspirin to prevent cancer, particularly colon cancer. This is the first time that we've heard this.
You know, there's been some small studies over the last 10 years that look at aspirin at preventing different types of colon cancer. This new data is pretty significant. We think that cancer is related to inflammation in the body, and aspirin blocks inflammation, and that's why it seems to work. And I think that if you're going to take it for 10 years minimum, it will make a difference in your rate of colon cancer.
And as far as the age group that would be most beneficial for this, is it still 50 to 59 to 60 to 69?
That's the age group that the new task force laid out. They did say that if you're in the younger group, 40 to 50, you really need to sit down and assess your risk carefully with your doctor and weigh it against the risk of taking the aspirin. And if you're older than that age group, you need to sit down carefully with your doctor as well. It's all about balancing risk.
So if you're not, though, prone to cancer, if you don't have a family history of it, would it still be recommended for people to take it?
I think so, particularly if you have that lifetime risk of heart disease at 10% and your risk of bleeding is low. I think that the benefits certainly outweigh the risk. And you just need to continue to partner with your doctor and monitor, you know, how you're doing on the therapy.
This one suggests that a Mediterranean diet rich in extra virgin olive oil can cut women's breast cancer risk by almost 70%. Spanish researchers tracked women between 60 and 80, so those eating mostly the fish and olive oil type of diets really did reduce their risk significantly. I've heard this before, though, right? So what new information is coming out of this?
You know, I think what this shows us is that we've known for a long time the Mediterranean diet is great at preventing heart disease because heart disease is an inflammatory disease. So is cancer, so is breast cancer when you have this inflammatory state. We know that things like olive oil have lots of antioxidants and can really reduce your risk. So I think that this new study is pretty important, and I think it shows us that there's even more benefits from this healthy diet.
Were they able to put a number on the benefits of this, like percentage, is how much, of an impact, a positive impact this could have?
They did show that it reduced the rate of breast cancer by about 68% in these women that were in the study. It was a fairly large trial as well, and it was very well randomized, so the data is robust and helpful to us as physicians. What we need to remember, though, is obesity puts you at risk for cancer and heart disease. And if you're eating a healthy diet with fish and vegetables and olive oil, you're much less likely to be obese.